Oregon for Legit TV, and welcome to another episode of Through the Chair, a one-on-one candid discussion with the committee chairpersons of the committee is Senator Ray Fonseca, chairman for the Committee on Health, Hospitals, and Human Services. How are you today?
Hey, I'm fine, blessing, thank you. How are you doing?
I am doing wonderful.
Good,
Who
good.
are the members of your committee?
Okay, I have the only super committee, the Health, Hospitals, and Human Services. So we have 9 members. We have our president, Norville Francis. We also have Carla. We have Senator Gittins, Diane Capart, of course myself. We have Maurice James, Donna Fred Gregory. We also have Samuel Carrion on the Committee of Health, Hospitals, and Human Services. Oh, Marvin Blyden, that's right, the Vice President Marvin Blyden as well.
Wonderful, thank you. So let's talk about the responsibilities of the committee. Please share with us the scope of the duties and responsibilities for the Committee on Health, Hospitals, and Human Services.
It's very broad. Of course, health, you have 2 hospitals. You have several clinics. We have the Ingeborg Nisbet Clinic on St. Croix. We got the Myra Keaton on St. John. We have the Department of Health. The Department of Health is a real large agency that have a lot of different programs. They have, for example, environmental health. They have the MCH, the maternal child health. They have the WIC, the Women's, Infants, and Children. They have immunization. There's a lot of programs in the Department of Health. And then also we have the Department of Human Services, which in itself is also an extremely large department, which includes like the Queen Louise Home, Herbert Grigg Home for the elderly on St. Croix. They also administer the SNAP program, the Medical Assistance Program. So we have a full plate, the Committee on Health, Hospitals, and Human Services, a full plate.
Share your thoughts on why your committee is included in the legislator committee structures.
Okay, well, health, hospitals, and human services, if you look at all the candidates, most of the candidates in the top 3 priorities, they have health or human services. And so right that alone gives you the reason why it's so important. But not only that, our committee is from birth until you pass away. So our committee deals from infants, toddlers, all the way to the home for the elderly when you need assisted living. So basically, it's extremely important. In addition to that, when you combine the 3 of them, that's where most of the government's money goes.
Absolutely. So who would you say are the critical stakeholders that Virgin Islanders can hope to hear from with this committee?
Okay, of course, I got to say the elderly. It is extremely important how we treat and care for our elderly. Most of them have spent their whole lives giving and working for the community. So that's very important. In addition to that, we have the infants and toddlers and the women, infants, and children. So from childbirth, we given assistance to nurture the children. As a matter of fact, from birth with the MCH program, it involves all the testing, all of the baby testing, for diabetes, sickle cell, and other types of degenerative diseases that we looked at. So it's very, very important. Of course, the hospital includes the care, when we are sick, we go to the hospitals. In addition to that, it encompasses the boards, the medical board, the dental board, the psychiatric board, the board of nurse licensure. It's a lot of items in the Committee of Health, Hospitals, and Human Services.
Yes, it is, definitely. What are some of the efforts that will be tackled first during the first 100 days of your leadership role as chair?
Okay, well, I'm happy to report that, the governor was on the radio saying, some people, graduate magna cum laude and some summa cum laude. Well, with the Wang Louis Hospital Mobile, it was kind of like thank you, Lottie. So I have to say that we finally got that open where all the patients have been transferred to the new modular unit. It's a 55-bed unit, and they have state-of-the-art equipment. They have the new latest CAT scan where, in 1 inch, they can take 32 slices of a 1 inch, give you a good diagnosis. They have the new incubator machine. They have a brand new operating room with the latest on-screen programming comes up. It's doing, it's very, very good. But in addition, there's a lot of other areas. We have the Cancer Center on St. Thomas. That is getting ready to be awarded to the contractor. We also have, there's a new WIC building that's being constructed. There's so much stuff. They have also a Herbert Grigg reconstruction plan. In addition to that, the Department of Health, which is located in Charles Harwood Hospital on St. Croix, they are going into a brand new facility. So it's a lot of stuff happening in the committee.
Overall, what are the immediate plans for your committee going forward?
Okay, well, I'm happy to report that I think one of the top 3 priorities was the nurses because, after the hurricane and then the pandemic, they had an issue with nurses. Nurses were being stressed out. We had the PAFFORD came down here. We had the issues with the traveling nurses. So one of the main areas was to make sure that we can retain our nurses. And in addition to that, to have our nurses' salaries increase. So I'm happy to report that that has been recently accomplished. The last 2 weeks, the nurses union have agreed to a new contract. I have to congratulate the governor's chief negotiator on that. But the nurses are now going to go up, they were at 63. They're going to go up substantially. And so I'm happy to report, so we will be able to retain the nurses. Of course, we need more nurses, but at least, you can't run a hospital, Africa, without nurses. So I'm happy to report that our nurses have signed the contract and have ratified the agreement, and there's progress moving forward on that.
Congratulations on the progress moving forward. Now, in terms of the nurse salaries that you just discussed, would you say that it is competitive to the salaries of the nurses on the mainland?
Definitely. They are worth it. Our nurses on the mainland go through the same educational curriculum. They go through the same state licensing. They work just as hard. It's only fair that we compensate them comparable to the nurses on the national average. So it's pretty good. It's a substantial increase, but it's what they are worth on the market. They just happen to be in the past being paid lower. So that's a good step in the right direction.
In previous testimonies from the CEO of the Schneider Regional Hospital as well as the Juan F. Louis Hospital, they often spoke about how one of the challenges with the nurses is the traveling nurses program. The traveling nurses are making a lot more money than our local nurses. Is that an issue that you plan on tackling?
We've resolved that because the traveling nurses agreement will expire shortly, and we've given our nurses a substantial raise. But we always will have a need for additional nurses because nurses they are needed in the hospital. As a matter of fact, I would like to quote here from you because I was doing a little research here because nurses' satisfaction, right? There was a recent poll here done where they say almost a third of the nurses in the United States are considering leaving their profession after the COVID-19 pandemic. They cite stuff like, fatigue, working conditions, et cetera, et cetera. So, and this survey was just conducted in January of this year. So I think our nurses now, we're on the right path. We now have to improve their working conditions. And I have a list that, we have a hearing on the Committee of Health, Hospitals, and Human Services this Wednesday. Today's Monday. So we're going to be addressing those needs because there's a lot of equipment and some other issues that the nurses need to be able to perform their job adequately. They have to have new blood pressure monitoring machines. They have to have all the needles. They have to have all of the other diagnostic machine, your blood, oxygen, all those things. So I have actually received a listing of those items that are needed. Of course, with Wang Louis, they're in a good position that they have all brand new equipment. But with the Roy Schneider and St. Thomas, we have a listing. So we're making progress. It's a lot of work.
How do you plan on carrying out these plans?
Okay, well, that's a good question. You see, we have to realize, right, that we are right now losing, the hospitals are losing people to the United States because of the perception that they can get better care in the United States. So the hospitals should be able to stand on their own. But right now, both hospitals are heavily subsidized by the government. And that's because, for lack of a better term, the patients that can afford to pay normally go off island because the perception is that they can get better service. So now that we have, like I told you, the new CAT scan, that is the same type of machine that you get in the Mayo Clinic or Cleveland Clinic. We have it right now in the Wang Louis Hospital. So we also have our doctors, our healthcare providers are board certified. They have the skills just like in the United States. So we have to be able to sell our own people that, hey, listen, you can stay and do that colonoscopy. You can stay and do that endoscopy here in the Virgin Islands. Of course, there's always going to be some specialized surgeries and procedures that we can't do here locally. So there will still be the need. But if we can tap into that market, then we can substantially improve our healthcare services to all of the community.
Now, how do you plan on getting that message out to members of the community? Because there is a significant amount of people who live in the Virgin Islands who actually do believe that they can get better care off island or on the mainland. So how do you plan on mitigating that message to that here in the Virgin Islands, you can receive the same care?
Yeah, you're absolutely correct. That is the perception that right now you can get better care off island. And I'm the chairman of the Health Hospital and Human Services, so I'm not going to say that that's true, but definitely in certain cases of specialized surgery, like, for example, I had a friend that had aneurysm in the neck, and she had to go away, and I actually have 7 different operations. So some specialties you can, but we have to be able to sell our community that we can do a better job here. And then, of course, when you go away, you're staying in a hotel, you're not with your family. They can't come and kiss you and say, Mom or Pops, I love you, and bring you a little, cake or something, even though you ain't supposed to eat a cake. They'll sneak you in a little cake because you want a little tart or something. So we now are concentrating on getting the diagnostic equipment. And once we have the same equipment, we already have the nurses that have the same training. We have the doctors that have the same training, so we now have to do an advertising campaign to be able to convince our folks. A lot of the stuff, the simple stuff, you can do it here, especially the outpatient procedure. So it's a public campaign that the hospitals are going to have to embark upon to get this accomplished.
In terms of the 3 biggest challenges facing the healthcare industry in the Virgin Islands, as chairman for the Committee on Health, Hospitals, and Human Services, what do you think are the 3 biggest challenges that needs to be addressed?
Okay. Well, number 1, I'm going to definitely say is we need to improve our early diagnostic. guys, if you have a little symptom of the prostate, go and get it checked. Ladies, the same message, breast cancer, prostate cancer, colon cancer, you know, diabetes, we have to get early diagnostic because, to treat a stage 1 cancer, right? Normally you have to have a little surgery, then you go home, you're good. You get your checkups. But a stage 4, you have to have massive surgery. In addition, you have to get radiation therapy. In addition, you have to get chemotherapy. And guess what? Your prognosis is still bad because you have a stage 4. In addition to that, it costs the government a whole lot more money. Now, we're not saying it to mean that it's bad, but if we can get early diagnostic treatment for our community, it would save lives. And of course, save money. But the main thing is it would save lives. Our people, our family members would live longer. So that's the number one item. You said it was 3, right?
Right, if you
Okay.
can. Yeah.
Okay. Well,
Number one,
number
yes.
2 was definitely the nurses, making sure that we have the nurses happy because, you cannot run a hospital without nurses. Number 3, I'll have to say, is improve care and treatment for our elderly. There's a lot of things that we can do for our elderly that we just need to do more. For example, there's a bracelet that you can put on the elderly, especially those that are having, cared by their family. The family might be caring for an elderly parent, but they have to go out and work. So while the elderly doesn't need 24-hour care, they need to be monitored 24 hours. So we need to be able to provide the free monitoring bracelets because even if you slip, you fall, or you're feeling sick, you can still, send off the alarm so that you can get care. So in addition to that, we need to have more programs for the elderly. I'm happy to report that we all have been funded, to rebuild the Herbert Grigg home. I think it's about $74 million, and also the Queen Louise home. So good things are coming. Good things are coming. Of course, I have to thank the Bryan administration and also the former chair of the Health, Hospital, and Human Services Committee, our current Honorable Senate President, Mr. Novell Francis. He chaired this committee prior to me. So we have a lot to accomplish, but I think those are the 3 priorities.
And I would also just like to add, in addition to the top 3, the emergency room services, oftentimes when testifiers do come here, they often complain about, the long wait for the emergency rooms at the hospitals as well.
Yeah. We discussed the triage system. It definitely needs a lot of improvement. You see, another thing that was happening, right, is that it's a lot of too much uninsured in our community. That's another area we have to address. And a lot of folks, unfortunately, the emergency room is being used like your primary care physician because they don't have a primary doctor, they don't have this insurance. So we have to address those things. But yes, definitely, I fully agree. We need to approve. Once you go to the emergency room, you need to be treated right away, or at least quicker than it currently is. And I don't think the problem is a lack of beds. It's some staffing issues, but I think that sometimes it's just a lack of insurance for the general population.
I concur. I mean, oftentimes they do say that uncompensated care, it's in the millions for the
Oh,
hospitals.
definitely. And as a matter of fact, I'm glad that you mentioned the uncompensated care because that goes into the insurance. Because let's go back to the example that I just gave you with the person have stage 1 cancer, right? So if they go to the hospital and they get diagnosed with stage 1 cancer and they have insurance, well, good. A minor procedure, you get a little surgery, whatever, you're good. Your prognosis is good. But if you don't have insurance and you didn't want to go, you wait until you get stage 4 cancer, Well, then guess what? You now have to have a lot of treatment, like I said, surgery, chemotherapy, radiation, and you have no insurance, so there's a lot of uncompensated care now that the hospital have to give to you because you don't have the insurance. And so this is where that insurance ties in and the uncompensated care. So we need to ensure that more folks in our community have insurance and that more folks are diagnosed early, and that would reduce the uncompensated care. Of course, the other thing is that right now, with the CON, there's a CON process, they call it the Certificate of Need, where the Commissioner of Health is authorized to give, for example, you, Africa, suppose you are a brain surgeon and you want to establish a brain surgery outpatient clinic. Well, you'll come down and you'll establish your procedure, you'll apply for your permit. The Commissioner of Health will grant you a permit to do brain surgery in your outpatient clinic. It's not in a hospital. So guess what? You're going to take the good patients, the one that are paying, and that is robbing the hospital. Or robbing is not a good term, but it's competing with the hospital for the best patients that are able to pay. And of course, the hospital left with those without insurance, and that's the uncompensated care. So those are some of the things that we have to address. It's not easy, but we have to do it. We have to be able to sell ourselves that we can provide improved patient care.
What are some of the short-term goals of your committee?
Okay, well, we want to make sure that the Kinnamall Cancer Center is up and running. That construction starts soon. The bids go out within the next month. We want to get that Charlotte Kinnamall Cancer Care up. In Wang Louis St. Croix, we that construction is moving along for the permanent replacement. The Inga Nisbet Clinic in St. John, that is in the design phase. That is coming out. In addition, with the Department of Health in St. Croix, the modular unit for where they're located in the Charles Howard complex area, that new construction is going on. We're going to show a video of that in our June hearing. And of course, the human services area over here in the North Hansen clinic, that remains a major challenge. I was there the other day. There's some issues. I don't want to discuss it, privately like that, but there's some issues. I think we have a lot of good employees in the Human Services Department. We have to look at some of the priorities, where it has been. So there's a lot of challenges. The Health Department, I think, I used to serve as the Chief of Staff to the Commissioner of Health, and our funds was about $56 million, and now the funding that they're operating at is substantially less. And when we were receiving $56 million, this was a couple years ago, 10 years ago. So I know what the Health Department is feeling with that reduced budget. So we have to be able to grow our economy. That's where tourism and tax revenues and the rum cover over and all these other economic incentives can help the government so that we can put more back into health, hospitals, and human services. So it's a big job, and I'm looking forward to it. That's why you elected me as your senator to help fix these things. So there's a lot of challenges, but we're looking forward to the challenge.
What would you say your long-term goals for your committee?
For health, hospital, and human services, I want to get, there's a possibility that the whole of the Roy Lester Snyder Hospital might be replaced. So we'll be able to replace the whole Roy Lester Snyder Hospital. This is a big deal. We'll be, of course, right now we're replacing the Wang Louis. I want to be able to get the Human Services Department in the same level where that North Hansen Hospital, I was born in, I was born in Savannah, but, North Hansen Hospital at the time, my mom had 7 kids, so by the time it came to me, our mom I needed was a midwife. She had a lot of experience. So I was actually born in Zebedee Calwood House on the floor in Savannah. But you know, I was good. But the Northampton Hospital, it's been here a long, long time. That needs to be substantially modernized. You know, we need to look at the engineering recommendations. It may need to be demolished and completely rebuilt. Also, the old Moorhead complex where Burt Paper and environmental health is located, that of course is a historic structure, so that needs to be in compliance, brought up to, you know, historical code, etc. There's so many challenges that we need, you know, so many challenges. But the main thing is we need to have the best staff and we need to pay competitive salaries and provide a nice, decent, safe work environment. So there's a lot, because, you know, you're talking about thousands of employees in health, hospitals, and human services, thousands of employees in the community.
Does this committee role foster in part of your overall efforts as a senator?
Oh, yes, most definitely. When I was campaigning, one of my major items was the early diagnostic, you know.
Preventative care.
Yes, and so definitely, and of course, you know, I think I have a lot of experience in the health area. You know, so that was definitely part of my priority. But you know, overall, you know, priority, I have some other major items that I want to discuss that is not related to the health hospitals and human services, but we'll discuss that in another segment when we get to it. But health hospitals and human services, everybody, that's one of our top three priorities. Of course, education also, and some people would say the economy. With the economy, I think that the Virgin Islands is on the right track. There's billions of federal dollars, but one main concern that I have is that I don't see us having the workforce that we need to be able to finish all of these projects. So one of the things that I really want to push and I'm an advocate for is that you know, we need to also provide educational assistance to our sons and daughters that want to pursue a technical career. Like if you want to be a dental assistant or a radiology technician to, you know, do cancer screening or something like that, or even an elevator operator or marine mechanic. All those are skills that's needed back in the Virgin Islands, that you get a paper certificate, you get a diploma that is also an education. So I look at education overall as not just a college degree or a diploma, but also if you're certified as a radiology technician, that is education. If you're a dental hygienist, you know, if you're a marine mechanic, you're a certified electrician, all of those things I look at as education. So overall, those are some of the other items that I definitely am interested in assisting my colleagues here in the 35th legislature to address.
Senator, thank you so much for taking the time to sit with us. But before we conclude, do you have any final thoughts?
Yes, you know, I would like to say that, you know, I'm so grateful for the community for expressing your vote of confidence in me. You know, rest assured, I will continue to advocate and shine light on all of the pressing matters that our community need to address. And I will always stand up for the poor, the elderly, the blind, the disabled, the veterans, those in chronic pain, and those that cannot speak for yourself. So my office is right here. You come in the legislature building on the first floor. You come in the building from the front. You make a left, and you'll see my office there. We have an open door policy. You're welcome to come in. Even if I'm a meeting, we'll get to see you. If I can't see you now, we'll be able to see you immediately because, you know, I serve all of my constituents. Everybody is important. And once again, blessings, and thank you very much for having me.
Thank you for joining us, and thank you for tuning in to another episode of Through the Chair. I'm Africa Harrigan for Legit TV.